How do you balance nursing school and work? Yeah, it's a little difficult. Tribe member believe they are a CNA and they just got accepted into nursing school and they're a little worried about how they're going to manage all that at once while maintaining their job. They did not specify whether full-time, part-time, or per diem, but it sounds like they're going to work straight through nursing school. So, first of all, strong work. That is not easy. But it's going to be hard. Here's the thing. Nursing school requires almost 99% of your whole being. You're going to be doing something with nursing school every day for the next however many years. Sure, you're going to get, time off in between semesters where you can actually breathe and have a little bit of sanity. But nursing school just is overwhelming and cumbersome. It takes every part of your being. It just sucks the life out of you. It's just that hard. Not only are you going to have to worry about the traditional didactic learning, actually going to class and lectures and tests and exams. You not only have to worry about the didactic part, but you're also going to be tasked learning the anthropomorphic, did I say that right? The anthropomorphic part of the hand-eye coordination, having to perform certain skills that are going to be a part of your clinical experience. Clinicals will vary depending on your program, how long it is, where you're at within your profession. In entry-level nursing school, becoming a registered nurse, I want to say there's close to 4 semesters worth, maybe more, of clinical time. I don't know how many hours it is these days. I'm a bit of an old school nurse, but you're going to have to spend quite a bit of time at the bedside. It'll start out as observation only, then it'll turn into a stepwise fashion of you'll have to do a single skill, one more skill, a set of skills, to the point where you're actually going to be managing the care of at least one, if not multiple patients. So you're going to have to apply the knowledge that you learn in school. Throw that into a bowl with a bunch of other things that you're going to have to do, like writing papers, giving presentations, group projects, having to do a lot of research. These are not new concepts. Depending on your level of education that you're pursuing will determine just how in-depth you're going to be going. I started out in a diploma program, then moved on to a bachelor's program, and then to a master's program. Why, yes, I went back to school 3 times. So depending on your level of entry, the amount of work you have to do is commensurate with the level of education. As you can imagine, when you go to get your baccalaureate degree, there is a certain amount of education that goes with the baccalaureate degree that don't even have to do with nursing. Same thing applies when you go to get your master's. There's a lot of behind-the-scenes stuff that you're going to have to do. Not to mention clinical requirements and having to do, skill checkoffs, having to perform things like, can you monitor a blood, can you take a blood pressure, can you do a subcutaneous injection, having to do first aid. So these are all stepwise things that are going to be a part of the overall nursing process. So you're going to have to do that depending on if you're doing that full-time, part-time as a student, and then the other half, you're going to have to worry about studying. Then somewhere in the middle there, you're going to have to do your job. Work at whatever job you're at. This is my long explanation for having to create a very regimented schedule. You need to stick to the schedule, create the schedule, and follow the schedule to the T no matter what. Life gets in the way, we all understand that, but In order to succeed, in order to pass your classes, in order to learn the material that you need to learn and acquire the skills that you need to acquire, you are going to have to become very regimented in your learning process. If you are a procrastinator, you are going to have to start writing a lot of things down. You're going to have to use alarms to remind you of tasks and projects. Get a planner, start writing stuff down. Triplicate everything you do. Put a calendar in your office, in your house. Put a calendar at work. Put a calendar on your phone. Put a calendar in the notebook that you have. Recruit help. Make sure that people are out there, understand your level of commitment. Time management is probably the single most important thing that you can do in order to succeed balancing work and school. Time management and the discipline to adhere to a schedule is probably the most important thing that will get you through all of this. You have to stay very disciplined and regimented in what you do. You need to make sure you're studying every day. Every single day, 30 to 45 minutes, up to 2 hours every day studying something. Working on something. Either by yourself, with a partner, in a group, discussions online. You need to study every single day. 7 days a week, study a little bit every day. You do not want to be the crammer. I was a crammer. I used to wait days. On my first trip through school, I was a professional procrastinator and I suffered for it. I learned about halfway through the program that you have to become disciplined. You have to work on something every day because it's a lot easier to chip away in small pieces and small chunks than to wait for something to build up until it is overwhelming, and then you have to spend every waking moment for 3 days straight trying to cram all that information into your brain. First of all, it ain't going to stay there. Second of all, it's not effective. Third of all, you're going to forget it all. So, become regimented. Study every day. Time management, strict schedule, and last but not least, be realistic. Do not try to conquer the world. Do not try to do all things for all people at all times. You're going to have to say no to a lot of things. I've joked about it before, but during nursing school, you're going to put your life on pause. There's a lot of things that you're going to have to say no to in order to get through what you got to get through. You're going to miss a couple birthday parties. You're going to miss a couple nights out with the friends. You're going to miss some important events during those 2 to 4 years that you're in nursing school. It's a simple sacrifice that you have to make in order to get where you want to go. And if I had to give a fourth tip, it would be sacrifice. Be willing to sacrifice. Sacrifice things as simple as sleep up to not going to the latest and greatest event, party, gathering. And last but not least, it's okay to stumble and fail. It's okay to fall flat on your face with whatever plan you come up with. Be willing to adjust. Be willing to change the plan after the first time you fail. It's okay. Failure is just an event. It is not who or what you are. And as always, check your own pulse first.